Thank you, Brother Izzat, for a warm speech. So before that, I would like to introduce our honorable speakers for today. Our first speaker is Assistant Professor Dr. Siti Sawana binti Kamsan. She was graduated Bachelor of Physiotherapy in UiTM, also finished her master degree in applying in physiotherapy musculoskeletal at Sheffield Hallam University in the United Kingdom, and just finished her PhD in physiotherapy at UKM. She also was a former physiotherapist in PPUM, Clinical Intan Medical Center, and Hospital Pantai Bangsa Kuala Lumpur. Currently, she is a physiotherapy lecturer in IIUM and has published two papers related to knee osteoarthritis in Index Journal in 2020. Next, our second speaker is Miss Tan Yin Lee. Hi. She has graduated in physiotherapy from Massa University and completed level 1 of osteopathy in craniosacral therapy in Indonesia, clinical neurodynamics in upper and lower quadrant in India, Maitland concept in Malaysia, and Mulligan concept part A in Bangkok. She also actively involved in treating triathletes, runners, cyclists, futsal players, and currently servicing our ex-bowling gold medalist Shaidatul Afifah. She also has represented the water hockey team, and she was an on-call physiotherapist for Police Evo 3 set, and currently she is a physiotherapist for Zizan Razak. Alright, now, without any further ado, let's start the session with our first theme, which is physical well-being. So, Dr. Sawana, could you please briefly tell us a bit about the physiotherapist's role in general, and also can you share your experience as a therapist in coping with physical well-being?
Okay, first of all, Assalamualaikum and good morning to all. Thank you for joining us today. Okay, therapist, so known as physical therapist. Yeah, it is a healthcare professional who assess and treat people with any physical difficulties. Yeah, and the main role of physiotherapists is to provide therapeutic treatments to people with physical health issues, which caused by maybe aging, illness, injuries, accidents, and others. Eh? And physiotherapist also helps people to improve their quality of life by optimizing their physical function. So the treatments or therapeutic treatments provided by physiotherapists include electrotherapy modalities, manual therapies, manual therapy, soft tissue mobilization, bio, mechanical advice, and others. Okay, so when talking about physical being, we physiotherapists have a role in promoting a healthy lifestyle through physical activities and exercise. The benefits of physical activities and exercises has been reported and has been proven in many studies. It includes risk of developing serious disease like diabetes, disease, hypertension, osteoporosis, and other diseases. Okay, other than that, exercises and physical activity also can help us to manage our body weight better and also help us to be more fitter and also help our moods and sleeps. So, is my voice clear so far?
Yes, clear, Doctor.
Alright, so to have or to maintain or to increase the physical well-being, actually we need to be active. Okay? And based on international physical activity guideline, we need to engage with any moderate physical activity exercises is 150 minutes, which equivalent to 3 hours per week. Okay? So example of moderate activity include brisk walking, and jogging at slow pace. Okay. And those who have physical difficulties, we as a physiotherapist, we will design a specific exercise program for these people so that they can improve their function and improve their physical health. That's all for what is physiotherapy and what is the physiotherapy role in physical well-being. Yeah, so far we do a lot with exercise program.
Okay, thank you, Doctor. Can you share a little bit of your experience as a therapist?
Okay, as I mentioned before, I have treated a lot of cases with physical difficulties lah. All patients, we will design the exercises according to their difficulties. Each patient will present with different condition. Based on the comprehensive assessment, we will advise them how to do the exercise properly. So hopefully, if they do the exercises, their functions definitely will be better.
Okay, thank you, Dr. Savannah.
Most of the cases, when they do exercises as planned by the physiotherapist, inshallah, they will regain their abilities, physical abilities.
Okay, thank you, Dr. Savannah. So, regarding our first team, we have received a few questions. So, I have the first question is for Dr. Savannah. So, usually people say that they have a sendi or urat masuk angin. So, what is actually means by that, and what is the exact management for it?
Okay, when talk about sendi or urat masuk angin ataupun angin masuk urat ke whatsoever lah, controversial actually because scientifically the angin cannot simply go into the urat. Okay, and the angin is not possible just to get into our body through our skin, hair follicles, or even our sweat gland. Okay, but yes, in our body we do have angin, but it is in our lungs because when we breathe, definitely we will breathe in the oxygen, the air. Okay, the air or the angin will be in the lungs. Okay, other than lungs, we also have angin in our body, in our stomach and intestine. But that one due to digestion process lah. So for urat masuk angin, maybe it is related with muscle knot. Okay, muscle knot is a condition where there is a small bump under the skin that is painful to touch, and actually that bump is not angin. Okay, it is a soft tissue under the skin. It's very tense and tightened, meaning that the soft tissue under the skin is very tense and tightened. That's why they develop bump. Okay, and that bump, of course, quite painful to touch. Okay. The causes for muscle knot can be caused by poor posture, overuse, injuries, and other factors as well. Okay, so what physio do with muscle knot? We apply heat therapy. We also advise patients to do some stretching, gentle exercises, gentle stretching exercises, and also, if necessary, we will do soft tissue mobilization over the affected area.
Okay, thank you for the explanation. So we move to our next question is for Miss Cindy. Next question is, does IC management for soft tissue injury after its acute period, will it delay the healing process? Example like ankle sprain.
Okay, hi, good morning everyone. Hi, doctor. Okay, so yes, because it's going to delay the healing process because after which is the subacute and chronic stage, whereby ankle sprain do really affect only one or two ligaments, but they actually affect the entire lateral compartment of the ankle, and sometimes it goes to the tibialis anterior and the muscles surrounding it. So after the subacute period, you actually need some heat to actually channel the to channel that healing process will occur. So for example, if you keep icing the structure after the acute period, what happens is there will be vasoconstriction of the muscles, and also the muscles cannot really, relax and regain its flexibility. Okay, and then icing tight muscles will cause more harm because vasoconstriction will occur, and preferably after the first like 72 hours, it is advisable to use heat therapy, and then you can really apply to the muscles, also the ligament. And also, like before we apply anything, it's better that we assess the client's nature of pain, whereby we don't only ask them, what is your pain scale? Okay, we have to direct them. Where, for example, this is what usually I'll do is I will give them a pain scale from 0 to 10. Okay, this is what we usually learn, like 0 to 10. But I will guide them whereby I'll say 1 to 3 is discomfort, soreness. Okay, 4 to 5 maybe some slight pain, and then 6 to 7 some mild pain. 8, 9, 10 is excruciating pain. Okay, so when they tell me that, oh, I rasa ada sedikit soreness and discomfort, you cannot put ice, because if you put ice, it will actually cause constriction at the muscles, and the muscles will get tensed up easily. Because ice is only to reduce the pain, but not really to, for healing process. So if the patient say, oh, I feel a bit of discomfort, you have to proceed with heat therapy already. If you keep on putting ice, it will only cause tightness, and also, pain is going to relieve, but healing process won't occur.
Okay, thank you, Miss Cindy. It's very clear explanation. So we will move to our next question. For Dr. Sama. So massage chair like Gintel give the same effect to help reduce muscle pain as the manual massage is. What do you think?
Okay, massage chair and muscle pain. Okay, yeah, there are a lot of massage chair nowadays, and actually there is no definite answer for this question. Why? Because muscle pain actually can be caused by many factors. Okay, and the common cause, for example, the common cause for muscle pain include infection, muscle tightness, overuse, injuries, and other things lah. So we have to look at the cause itself. Okay. For example, infection or muscle tightness. Okay. For example, muscle tightness. Okay. Muscle tightness only can be resolved by stretching exercises. So muscle pain caused by muscle tightness definitely cannot resolve by massage chair. Okay, so it's not appropriate. It's not effective. Okay, but if we want to use massage chair just for fun or just for relaxation purposes, definitely fine. Okay, but for treating muscle pains, need to be careful again, because of we need to determine what is the causes of muscle pain. And in physiotherapy practice, we didn't use massage chair to treat muscle pains. Okay, no matter what is the cause of muscle pain, we didn't use the massage chair.
Okay, thank you, Doctor. So we move to our next question for Miss Yini. Back to Miss Yini. So this question said that it lost but remains slim. Does it mean the person will have a high metabolism? What your thought on weight loss tattoo?
Okay, so this is a very famous question. So I think, like, other than high metabolism, okay, which is burning calories at resting state, we also have to look at overall their lifestyle. Okay, sometimes some people they makan banyak, but they still remain slim. Is you have to look at their calories intake. Maybe dia makan banyak vegetables or anything that is low calories. So we have to look at that area. Okay, some people they makan sikit tapi dia makan a lot of maybe fried chicken and stuff like that. So we have to look at the calories intake, because nowadays we are all talking about calories, whether it's sufficient or not for our body assumption. And then next is we have your lifestyle. Some people dia makan banyak, and at the same time they do a lot of activities which is macam, if they want to go to their office, they can't the best. compared to people yang makan sikit but they are still, naik lift, for example. Okay, all these small activities will actually affect the burning calorie part. So you can see people they eat a lot, but at the same time they also do macam Dr. cakap, they do a lot of brisk walking. They fulfill at least 150 minutes per week. So I think that does up. So if you want to talk about weight loss plateau, you have to really look at entire, not only makanan, but also your lifestyle, exercises, whether you are doing it correctly or not. And then some people, they do exercise, macam our heart rate, we have 5 zones. Okay, for example, 5 zone kan. First zone, you're talking about overall fitness and stuff like that. Some people, kalau they lost weight, you have to make sure that your heart rate is actually at zone about 3, 2 and 3, zone 2 and 3 of your heart rate. Because if you move to zone 3, you are actually improving dia punya speed performance. Contohnya lari. Some people keep on running, tapi their what do you call it? Their weight is still not losing their weight. Then you have to look at whether they are doing the right way of running or not. Whether are they hitting zone 2, zone 3 ataupun dia dah penat sangat. You actually focus a lot on your performance. You're not burning any calories. So you have to look at overall. Yeah.
Okay, thank you, Miss Indy. So, Dr. Sawana, do you have any thoughts about this question?
Yeah, I agree with Miss Yin. Yeah, weight loss plateau is where the body weight is thought to reduce, okay, or to drop even after following regular exercises and diet. Okay, so actually when we have weight loss plateau, it tells us that we need to cut more calories and increase our physical activities. But calories definitely not less than 1,000 lah. Yeah? But after we cut more calories and increase our physical activity, if the body weight still don't drop, maybe we need to consult to the proper person, for example, doctor, dietitian, or physiotherapist. Okay, so that maybe we can reduce the body weight more lah. But of course, you don't have to reduce your body weight until you get underweight, right? Just reduce your body weight up to the normal weight lah.
Okay, thank you, Doctor. So, we move to our next question. Before that, all the participants, you may ask in the chat box if you have any concerns or to ask to our panelists. So, next question is for Dr. Sawana. So, usually people when they feel pain, they usually use minyak angin. So, how can actually minyak angin treat musculoskeletal pain, and what is the level of the effectiveness compared to other heat therapy?
Minyak angin kan. Okay, actually to be honest lah, as a physiotherapist, I couldn't find any papers or any evidence, reports on the effectiveness of minyak angin on reducing pain. Ataupun maybe I tak perasan ke, tapi at the moment, I tak boleh nak, I masih tak jumpa apa-apa paper yang, a study on the effectiveness of minyak angin in treating pain. And if you ask me, minyak angin or heat therapy, definitely for physio heat therapy lah. Okay, and minyak angin, I think maybe we can have a better opinion from the proper person from pharmacological fields. Because me as a physiotherapist, I'm not sure what is the ingredient of minyak angin itself. Okay, so I'm not sure how the minyak angin produce heat when we apply over the skin. But for heat therapy, for example, hot pad, when we apply hot pad over the skin, yes, it will reduce pain because of it will, dilate the blood vessels over the applied area. Okay, so when the blood vessel is dilated, it will improve the blood flow. So when the blood flow is improved, it will supply good nutrition, okay, for the healing process. So that's why it can reduce pain. Other than that, the heat therapy can produce some anesthetic effect because of the heat itself. It's not because of other ingredients. Okay, it's dia melegakan. Heat tu, haba tu melegakan tempat yang sakit. But if you ask me about minyak angin, definitely I cannot comment much about it because I'm not studying the ingredient of minyak angin. Okay, so that's all.
Okay.
So maybe we can have further discussion about minyak angin with other experts.
Alright. So what do you think of like Yoko? Is it suggestible to use?
I tak pasti, tapi sepanjang my practice, I never advise my patient to apply Yoko over the painful area lah, never. I memang tak pernah minyak angin or Yoko. But yes, our patients, it's normal lah. It is their rights kan to take whatever they can to reduce the pain. But we physiotherapists, I tak pernah lagi setakat ni advise patients kan Yoko ke minyak angin ke minyak apa lagi yang available in the market. Memang I tak kenal lah so far. But and I believe most of physio out there they don't advise patients to apply minyak angin. But maybe for certain circumstances, maybe minyak angin can reduce the pain. But again, as I mentioned before, pain can be caused by many things. So if you ask me the effectiveness of minyak angin for pain, that's why you have to look the cause of the pain. Like I cakap tadi lah, kalau pain due to injury, of course lah minyak angin is not appropriate ataupun memang tak sesuai langsung untuk injury ataupun to infection ke, of course lah tak boleh juga.
Alright, thank you. So Missy, do you have any thoughts about regarding this question?
I think like Doctor said, minyak angin is I think it's traditionally famous lah. Okay, minyak angin, minyak urut and stuff like that. And then macam kalau me when I'm on field that means on field macam kalau I have only a bed and people come to me with sudden injuries. Usually what you know those sprays, those spray and after that cool gel, cool gel, you can actually apply that acutely. That means macam kalau dia datang dengan ankle sprain and something tapi dia nak kena sports injuries and sports activities, what we do is we will just apply cool gel because cool gel they have menthol. Okay, menthol is actually to have that angin effect and cooling sensation. Macam doktor cakap, it's not going to heal you, but it's just going to mask off the pain. Just going to shadow the pain and make you feel that, oh, you're feeling the cooling sensation, but the pain is there. So you have to do other treatment to overcome the pain.
Okay, thank you, Miss Cindy. So, shall we move to our next question? So, next question is for Miss Cindy. So, what is common problem of post-pregnant women in terms of musculoskeletal, and what can it be treated with massage therapy like myofascial release?
Okay, so post-pregnant woman, okay, sometimes masa dia nak mengandung, usually because I nak pernah mengandung, so I don't really understand from their point of view. But as I know that I treat some people, dia sebab they're having baby in the front, so what happened is their lumbar kind of went to hyperlordotic punya posture, okay, because the abdomen is slightly heavier. So what happens is they will have this kind of lordotic even after their pregnancy or after their delivery. So from there they might have some lumbar issues, and they will have a lot of pelvic pain. So what I'll do is, of course, I will first assess them, and then we do some personal release, especially at the QL, the quadriceps lumborum, and also focus on the quadriceps because everything on the front gets tightened up also. And then after that, maybe perform more exercises to get their pelvic back into neutral alignment. Because if you only focus on massage therapy, it's going to just relieve the pain temporarily. You have to include more exercises and get them back into their neutral alignment before their pregnancy. I think these are the most common ones: lumbar issues, and then some tightness at the pelvic area, and then maybe some of them they actually have a lot of extra fats at their hip. So from there, we will also train them to be fitter back sebelum their pregnancy.
Okay. So, Dr. Sawana, do you want to share anything regarding this question?
Yeah, I agree with Miss Ying. Yeah, definitely low back pain is the most common complaint among post-pregnant women, because as the baby grows, the uterus and the abdomens are expanded, and it will pull the lower spine. Okay, and this will cause into the back muscles. And if the mother has gained so much weight through the pregnancy, the body itself will put extra pressure on the back muscles and cause chronic pain. Okay, in some cases, low back pain will disappear or will go away within 3 to 6 months. But there are many cases also where the mother has low back pain over the years, and this is probably due to other factors as well. Okay, for example, poor posture, weakness of the back muscles, and then using high heels and others. Okay, so as a physiotherapist, we will advise those who have low back pains to see the doctors or physiotherapists to get a proper treatment, right? So that they will not suffer with back pain for so long. Okay, so in terms of treatment, myofascial release, yes, we can do myofascial release as a physio, but other than that, we can do other things. Okay, depending on the causes of the low back pain. Okay, if the patient present after assessment, if we find out that the back pain is due to posture, and then we will, as a physio, we will teach patients how to correct their posture. And for example, with muscle weakness, we will, as a physio, we will teach patients how to strengthen their back muscles. Okay.
Okay. Okay, thank you, Dr. Sawana. So, there's a question in the chat box from Nick Ashiki Razuman. So, she said that I have a question. If IC management is not suitable for the first management of the soft tissue injury, what are the other alternatives that we can do to fasten the heal process and at the same time to reduce the pain of injured person? So, maybe can you answer this question?
Okay, I think maybe my answer to the question earlier maybe is not very clear. Okay, so what I meant was icing management is very crucial for the first 3 days. Okay, macam kalau you ada ankle sprain, for the first 3 days, yes, you need ice management to reduce the pain. Okay, after the first 3 days, that means after 3 or 4 days, which the problem is already in subacute ataupun chronic stage, you need heat to actually improve the blood flow, and blood flow will actually allow more healing process to occur. And also other alternatives is you assess the client if their pain is tolerable. Usually what I will advise them to do is start with some isometric exercises. Okay, if they cannot bear any weight bearing exercises, you can actually start off with isometric exercises to improve dia punya basic strength dulu, so that when the pain reduce, you can straight away start with more advanced or other progression of exercises. Because if you just let it, of course they said about RICE, rest, icing, yes, but for the first 3 days. After that, it is better for them to be more active, slightly more proactive, so that when the pain and everything reduces, they will start, go back to their activities. This is what usually I would advise my clients to do. Doctor, any suggestion regarding it?
Okay, regarding ice management and soft tissue injury. Okay, following injury, okay, soft tissue injury, the first stage of recovery process is inflammatory. The first stage is inflammatory stage. So in the inflammatory stage, usually it comes with swelling. Okay, so we use ice to reduce the swelling actually. Okay, so we don't want to apply other things like hot pack because of we don't want worsen the swelling. Okay, but when the swelling is subsided, um, you can apply other things other than ice. Okay, the key word here is if there is swelling after injury, definitely have to apply ice. Okay, to reduce the swelling and inflammation. Okay, and then when the swelling and inflammation has subsided, then you can go for other treatments. Okay, remember in the inflammation stage, usually the skin will be in redness, swelling, warmness. So we apply ice to reduce all these symptoms. Okay.
Okay, thank you, Doctor and Miss Cindy, for the explanation. So I hope the answer that given by Doctor and Miss Cindy is clear to you. So we move to our next question by Ahmad Miaraj. So he asked, I would like to ask you about the high velocity thrust from physiotherapy point of view. Is it physiologically effective or it has only a placebo effect? So what do you think, Doctor and Miss Cindy?
Okay, for high velocity thrust from the physiotherapy point of view, is it physiologically effective or it has only a placebo effect? Okay, high velocity thrust. There is conflicting evidence for high velocity thrust. Okay, if you want to say about the effectiveness, there is no concrete conclusions about the effectiveness of high velocity thrust. Okay, depending on the conditions, if you want to apply or if we want to do a high velocity thrust on patients, um, um, you know, I think not all conditions is appropriate for this technique or this approach. Okay, only certain cases. Okay. Yeah, placebo effects. Maybe because when you touch your patients, okay, it will contribute to some placebo effects. Okay, but if you ask me about physiological effectiveness, at the moment there's no concrete conclusions on the effectiveness of high velocity thrust for a particular condition.
Okay, thank you, Doctor. Miss Cindy, do you want to answer this question?
I think, like Doctor said, physiology, because physio, we don't really practice all this cracking stuff like that. And then I think it's mainly just removing the air bubbles in the joint, and then patient they might feel temporary relief. So far, when I ask my clients, they actually feel relief, but for only 2 hours, they will feel some certain relief. And then I think it's just placebo effect, and you have to look at the condition that you want to trust. Some people get their ankle sprain and then they went to some bone adjuster. When they crack it, they actually worsen the problems. So I think it's just overrated of treatment and
Uh,
experts. Yeah.
okay, thank you, Miss Cindy and Dr. Sawana. So next question is from Brother Muhammad Ruzuhan. How to maintain body fitness for regular people in terms of stamina and strength? So what do you think, Miss Cindy, about this question?
Body fitness, first you have to know what is your goal. Okay, like you said, body fitness, or do you have any goal to achieve? So stamina and strength, I think it is better for you to start off with low heart rate exercises, because low heart rate exercises will actually improve your stamina. Because if you keep yourself to very high heart rate, what happens is one day you will get very tired and exhausted, so you won't have the the energy to do any of the exercise. Our main goal is actually to reduce your heart rate so that you are in a comfortable zone. And then in terms of strength, you can actually do a lot of maybe body weight exercises first. When you just want to start off your exercise, you do a lot of body weight exercise, and then slowly only you progress to weight exercises. But of course, with under people who can guide you properly, people they do a lot of mistake by doing a lot of HIIT exercises and then do a lot of strength exercises without guidance and without a clear plan. So see whether you nak reduce weight ataupun you nak improve your muscle bulk or you want to just look good. You have to know what are your goals first. Then only you can set the steps towards your goal. This is my opinion.
Okay, thank you, Miss Cindy. Dr. Sawana, do you have any thought this question?
Okay, how to maintain body fitness for regular people in terms of stamina and strength? Okay, what you can do is you have to regularly engage with the exercises. That's why in national guideline for physical activity for young adults, okay, healthy adults, it is recommended to do moderate intensity exercises for at least 3 times in a week. Okay, and the durations minimum 150 minutes or 3 hours in a week. That one for moderate intensity exercises. But if you want to increase your intensity of exercises, okay, maybe you want to do running, cycling, swimming. You can do still the recommendation is at least three times in a week. And the duration is about 75, I'm not mistaken, for high intensity exercises. 75 minutes. Okay.
Okay.
Mm-hmm.
Okay, thank you, Doctor. Next question from Afifah Asri. So she asked, what is actually the popping made by our and is it dangerous to do so?
Okay, popping sound. You mean when you lock your knuckle, is it?
Yes, yes.
I think the popping sound is just the air bubble that escape from your joint because we have a lot of air, just the air bubbles at your joint and then caused by the fluid that moves around. It is not so dangerous to do it, but if you keep doing it more often, actually your hands will, for example, the neck. Okay, a lot of people like to do neck cracking. Uh, if you do it just once in a while, it's fine. But if you keep doing it every morning, what happens is your ligaments might get overstretched, and also it will cause a lot of weakness. And if you realize that if you keep doing, you'll feel relaxed, but somehow every day, bila you buat setiap hari, you feel like you need to do it. Why? Because you are too used to cracking it and releasing it. So instead of cracking it to reduce your tightness, you can actually go for more active exercises to reduce whatever problems that you have. For example, at your neck.
Okay. Thank you, Miss Cindy. When you say that more active exercises, do you have an example of that activity, active exercises?
You mean for the neck?
Yes, yes.
For example, for the neck, okay, so what usually I'll ask people to do is some neck isometric strengthening exercises, okay, because this is the most general and applicable for everyone. So usually what I'll start off is actually with shoulder shrug exercises to improve their upper traps, because upper traps, their attachment is right at the top. So sometimes if their upper trapezius is not working well, they will actually cause a lot of migraine at the back of the head. So I will do that, and then I will improve all the muscles by doing, some exercise, which is you take the towel, you put it at the back here, and then you push it through the thing to cause isometric effect of the neck extensors. So by increasing the strength of all your neck extensors, you will actually have more support at your neck joint. So when you have more support of your neck joint, you won't be feeling like you rasa nak crack it. So you will really reduce the what you call it, the addition of the cracking.
Okay, thank you, Miss Cindy. So, I think we move to our last question before we take a break. So, the last question is the last question is what is the difference between chiropractic, also theta and bone adjustment? So, Dr. Sawana, can you answer this question?
Okay, the chiropractic, osteopath, theta, and bone adjustment. Actually, for chiropractic and bone adjustment, they are doing the same. Okay, osteopath and theta, I never heard about that. Maybe I need to read further. Okay, what they do is something like manual manipulations over the joint and bones. Okay, so the difference in terms of techniques, okay, definitely they have their own techniques to be applied, and we as a physio, our technique of joint manipulation also different from them. Okay, but I'm not sure if they also learns our techniques in their practice. But in physiotherapy, we do manual techniques or joint manipulation. But the difference between theirs and ours, to be honest, I'm not sure. Okay. But for chiropractic too, yes, they do something like crack here, okay, all over the spine, basically.
Okay, so do you think that we as a physiotherapist, can we specialize in this like chiropractic, osteopath, theta, and bone adjustment?
If you want to learn their technique or their approach, it should be no problem. You can, but specialty area in physiotherapy fields is not include chiropractic, osteopath, theta, and bone adjustment. We at the moment we don't include all these things in physiotherapy specialized area.
Okay, thank you, Dr. Sawana. So, Miss Amy, what your thought about this question? Since you have osteopath course, right? Miss Cindy, you not your microphone.
Sorry. Can you hear now?
Yes, yes.
Okay. So yeah, I really completed the level 2 of osteopath, and then macam doktor cakap we don't include all this in our physio because our physio dah cukup hebat dah sebenarnya. We don't really have to include all these things. And then macam when I went for the course, it's actually just to macam tahu what are the things that they do. And then I realized that in Indonesia, a lot of physios they actually prefer osteopath. In my opinion, osteopath is mainly they're totally different. It's actually different. And then, like for physio, when we want to assess people, okay, we assess them by macam muscles and then their functional, among functionals. Macam osteopath, for example, I bagi macam knee pain when you have knee pain, physio they will assess your muscles ataupun your joint above and below the knee, hip and ankle and stuff like that. Tapi for osteopath, they actually assess sampai you punya craniosacral, then you skull down to your sacral, and then they want to feel the fascia and the brain wave and stuff like that. Dia macam tak about with physio at all. And then for kita bone adjustment, they are more traditionally, so there are no papers ataupun no research to say that they're very well. Maybe people feel that kita is better than physio is because traditionally secara turun temurun people been telling this is good. So untuk diorang rasa good is okay lah, I got pain which is good. Actually it's not. Any treatment shouldn't apply pain on you. Macam kita physio, when we do any treatment, when it applies on the patient, then you are doing it wrong. And then in assessment wise, macam physio we have a lot of type of mobilization. Maybe we have some things to diagnose, special tests to diagnose. Untuk chiropractic, they don't really have any assessment technique. They only rely heavily on MRI, X-ray, because some chiropractor center dia memang tengah hire physiotherapy to perform assessment. because they don't really know how to assess. They only know how to read your MRI, X-ray, or kat sini this and that, this and that. They just crack it. It's all about cracking, and they also will hire physio to one about physio different than all this is actually we have exercise program to jaga the patient throughout the process. So untuk osteopath and chiro semua is just there only. And then like for what do you call that, for kita dia punya examination is basically dia dia dapat rasa yang your bone is out of the joint. This is macam tak ada research on that. So they are just putting it back the joint in the socket. So basically, I think all these difference, they are you need more research to see whether they are effective or not. That's it.
All right. Thank you, Miss Cindy. So, I think the time already near 10:50. So, thank you, Dr. Sawana and Miss Cindy. So, we will take a 10-minute break before we continue with our next session. So, participants, you may ask the question at the chat box during this short break. So, we will be back at 11 a.m. Okay, thank you.